Okay, so for sign offs this week, I'm talking about vital signs in children. First thing I want to talk about is the temperature. So you want to use the least invasive method of taking the temperature. So for infants, you're usually going to use the auxiliary. Um, you usually don't want to use rectal because it's the most invasive, and for infants, it can be a risk for perforation. By 5 years old, uh, the child now has the ability to take an oral temperature. So if you're taking a tympanic temperature, if the child is younger than 3, you want to pull down on the pinna and back. And then if the child is older, you want to pull up and back. And then for pulse rate, so it's best to assess the heart rate by listening for a full minute. You want to do it while the child's either resting or sleeping because activity can obviously increase the heart rate. So for the infant, it's about 80 to 150 beats per minute. The toddler, it's about 70 to 120 beats per minute. Preschooler is 65 to 110. And then the school age is 60 to 100. And then the adolescent is 55 to 95. And then we're going to talk about respiratory rate. So you want to, again, assess respirations while the child is calm, resting, or sitting quietly. So given that, you want to do respirations and heart rate first before you do anything else. You want to also count the respirations for a full minute. For the infant, the respirations are probably going to be around 25 to 55 breaths per minute, and it's going to be the belly. The toddler, it's going to be 20 to 30 breaths per minute. Preschooler, 20 to 25. For the school age, be about 14 to 22. And then for the adolescent, it should be like 12 to 18. Then for blood pressure, so this isn't really utilized until 3 years of age unless there's an underlying condition. The cuff width should be at least 40% of the circumference of the arm, and then the length should cover 80 to 100% of the circumference. And you want to make sure that the cuff is obviously the right size because a wider cuff is going to cause a lower reading, and then a narrower cuff is going to cause a higher reading. You can measure the blood pressure on the upper arm, lower leg, thigh, calf, or ankle. You can also do pulse ox for assessment of the vital signs. I mean, this is going to be normal to adult values. And then pain assessment can also be included in vital signs. And you want to use something that the child's going to understand. So often is going to be pictures of faces according to what they're feeling according to the pain.